Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hello, everyone, and welcome to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Marie Stella, coming to your ears from Naarm, Melbourne, Australia. Let's learn together.
Hello everyone and welcome back to the show. Today we're diving into a complex health topic, and that is the health of the bladder. Joining me today is our guest, Mischa Bongers, to explain all things prevention, infection, and even cancer in the bladder. Mischa is passionate about all things pelvic health, including continence, pelvic floor rehab, perinatal care, women's and men's health, and pelvic pain. After completing her master's in continence and women's health physiotherapy, Mischa started her own clinic, Pelvic Fix Physiotherapy, to help raise public awareness and improve patient access to quality pelvic health physiotherapy care in her local community in Central Queensland. Mischa also speaks at community events on the importance of good pelvic health habits, teaches in the Women's and Men's Health Unit for her local university's physiotherapy program, and supervises clinical placements for physiotherapists completing further studies in continence and women's health. Mischa spends her free time enjoying coastal life with lots of running, swimming, yoga, and playing frisbee with her dogs on the beach. What a wonderful lifestyle. Hi, Mischa. Welcome to this show.
Thanks, Sabrina. Thanks for having me.
Thank you for coming. It's really wonderful to have you with us here today. So, what are some common myths or misconceptions about bladder health, Mischa?
One of the big ones would be that bladder leakage is a consequence of aging and that everyone should
Oh,
just expect for this to happen, which isn't true.
I
Um,
see.
Another big one is uh, that women in particular, after pregnancy and childbirth and menopause, that bladder leaking is something that they should just expect to get and to just put up with. Again, not true.
And I do have a question about pelvic floor health because from what I know, it's quite big knowledge for the woman's side that pelvic floor and pelvic yoga is good for their pelvic area. But what about men? Why is uh, pelvic health important for men?
Yeah, well, we all have pelvic floors, not just women. So the pelvic floor is really important for part of our core stability. It's important for bladder and bowel control, and it's really important for sexual function for both men and women as well.
I see.
So we tend to find men don't have to think about their pelvic floor too much
Yes.
until potentially having some issues around the prostate. So they would tend to
Oh,
be affected a little bit later in life potentially than women.
I see. So is that why it's not so much of a common knowledge in comparison to how woman is taking care of their pelvic floor health? Since I think I've started hearing that since I was like in my early 20s or even my late teens.
Yeah, so it can sometimes be hard for the men because it's not something that they've ever really thought about or discussed much. So they're getting to, 60, 70 years of age and really not ever having to think about it much until some of these other health issues arise.
I see. And thank you very much for that wonderful preface for our topic today. But before we go further into our topic, let's break the ice and get to know Mischa a bit better. So this is Have You Met Mischa? Okay, so Mischa, what do you do in your spare time?
So you already heard a little bit about it. So I
Yeah.
definitely am. I love running, so I love running for fitness, but I also like the social aspect of running. I run with a running
Ah,
group, and I like traveling to run. So I've recently just got back from Adelaide, where I did the Adelaide Half Marathon, and I can definitely recommend it.
I see. So you do a lot of marathons?
I've done 2 marathons, more comfortable in the 10 to 21K zone.
Okay, that's super awesome. I've only started walking slash running a little bit.
So your local park run is a great place to start.
Indeed. And do you read any books?
Yeah, so, as my professional career has advanced, I guess, I've moved away from reading much fiction, and I kind of just get
Oh.
obsessed with reading nonfiction, work-related, health-related type things. So, at the moment, I've got Gabor Mate's The Myth of Normal on my, nightstand, which I'm getting through, which is a really interesting one about how our sort of lifestyle and culture is a major driver of chronic disease, and how Western medicine isn't necessarily addressing that as a
Mhm.
cause for a lot of our ill health.
And what's your favorite book throughout the course of your life?
Oh, that's probably a tough one. I don't know if I could choose anything in particular.
I see. What about films or TV shows? Do you have any favorites or the one that you've watched recently?
My all-time favorite TV show would have to be Dark, which is a
Mm,
German three season science fiction thriller type show that you can find on Netflix. I believe it's
dark.
still on Netflix. Dark.
Okay.
So I recommend watching it in German with the subtitles on, because the English dubbing was a bit hard to yeah, to watch, I guess.
Hard to digest, yeah. Ah, I've never heard of that one, so I'll check it out and put it on my list. And is there a podcast that you listen to, Misha?
Kind of like how my book reading has gone. I listen to a lot of podcasts that are about women's health,
Mm.
general health, lifestyle, some business related podcasts. Probably one of my favorites would have to be Yumi Stein's Ladies We Need to Talk. Brings up a lot of things that we don't talk about much, but are really important topics around, yeah, women's health and women's well-being.
Okay, and do you have a role model, either personally or professionally?
I think a topical one, and in, reference to longevity,
Yeah.
David Attenborough recently turned 99 years old, and I think that,
Oh,
his accomplishments professionally, what he's done for, wildlife and
yeah.
conservation efforts, all whilst being very modest about it, is quite inspiring, and the fact that he's still working, to my knowledge,
Yeah,
at
he
99 years of
is.
age is absolutely amazing.
Yeah, I've grown up with him as well, watching Nat Geo and his voice, and I didn't know it was David Attenborough for a long time, but I really appreciate his work and his voice. It's just
And apparently he's
amazing.
one of the most traveled people in history because of all the crazy places he went to film those
Ah, for
documentaries. Yeah.
wildlife. Oh, I
Yeah.
thought he was only just narrating those.
No, he's on set for a lot of them.
Ah, that's amazing. And what's a class or course you've taken that has inspired you?
What got me into, I guess, women's health, pelvic floor,
Hmm.
continence type things, because it's not something that you cover a lot in physio school as an undergrad. It really is something that you need to take a special interest in and do further knowledge on. I did a course mainly because I wanted to go to the Sunshine Coast, which wasn't probably a great reason to choose the course, but it was all about women's issues around pelvic girdle pain and managing common pregnancy related issues. And it just blew my mind, all the things that I didn't know. And it just got me started down this path of wanting to know more and more about pelvic floors and bladders and women's health and all of those sorts of things.
Alrighty, that's a wonderful outro to this segment. And how still in relation to pelvic floor, how would you define longevity itself?
I think if we think about it at a basic quantitative level, we're talking length of life, in numbers. But uh, qualitatively, I think we're looking at more the factors and forces that are creating a better and a longer than expected life.
Hmm. I see. And what can you give us a brief overview of the bladder?
So the bladder, we've all got one. It's an organ that stores urine for us. So
Mm.
the kidneys filter urine down into the bladder where it should be stored until a point where it is socially sort of like appropriate or we're ready to kind of empty the urine. So a bladder that's working well should be able to hold 400 to 600 mils generally. It should be able
Hmm.
to hold so that we are only weeing sort of between 4 to 8 times a day and maybe once at night, but potentially not at all.
Hmm.
Um, and it is something that, we learn to control over time. So obviously infants pretty much no control over their bladder. As we
Yeah.
move into like early childhood, we kind of get the messaging and know how to interpret those messages and how to kind of respond to those messages. And hopefully most kids by 4 are holding their bladder well over the daytime. By 7, they're usually holding well overnight, and then we're hoping that that control remains through the rest of their life, all going well.
And what does bladder health represent, particularly as we age? We did mention a little bit about it, but as we age, how does it matter?
So there are some changes that can happen as we age, well, that will happen as we age. We want to make sure those things aren't having a huge impact on our day to day function and quality life. So it is normal for the
Hmm.
bladder to become a little bit less compliant. It will get a little stiffer as we
Mm.
age, which means that it sometimes can, like the capacity will reduce a little bit. We obviously, as we age, all of our muscles do lose a little bit of oomph. So the bladder is
Ah.
essentially a muscle. So sometimes it will get a little bit less effective at emptying well as we get older. And then we've also got the sphincter muscles that control. So they sometimes can be compromised as time goes on if they're not well exercised and toned. The other thing that's obviously happening as we age is that we're more likely to be affected by other medical and health issues. So, neurological conditions like multiple sclerosis, Parkinson's, stroke, all of those things will often have a pretty big impact on bladder and bowel function. Overweight is something that will affect the bladder. So if there's more
Ah.
pressure, particularly in that tummy area, it might impact on the bladder's ability to hold well. Um, Hormonally, so women, particularly around menopause, are going to experience often a change in bladder function because of a decline in hormones that help keep those tissues that control the bladder sort of happy and healthy and strong. And then we talk briefly about men with prostate issues. So as men get older, they sometimes can be affected by an enlarged prostate, which is obviously going to mean it's a bit harder to empty the bladder, or prostate cancer. So often,
Mm.
if there's cancer, they'll look at removing the cancer, often surgically. And so taking the prostate away, which is a gland that sits at the base of the bladder in men, that's going to change the anatomy and how the bladder is able to sort of function and hold on. So all of these things can cause an impact. Medications can cause an impact. As we age, we tend to be less good at giving off the hormone that tells our bladder to slow down urine production overnight. So older
Ah.
people are more likely to wake up an inconvenient amount of times overnight because of a
That's
combination of
true.
factors. Yeah, but one of those would be that change in hormone production just not being as effective as we get older.
I see. And what is the sphincter muscle and how does it affect bladder health?
So a sphincter is any circular muscle in the body. So there are
Mm.
lots of sphincters all through the body. The bladder and the bowel both have sphincters that help to kind of shut off to help with control. So in order to empty our bladder or bowel, we need the muscles in the bladder and bowel to kind of contract to empty, but we need the cooperation of those sphincter muscles to relax to allow emptying along with the pelvic floor. So the sphincter muscles are part of the wider pelvic floor area. And then
Ah,
we need those sphincters to stay active when we're doing things through the day when we're actually not ready to go to the toilet. So they're quite important muscles. And the thing with bladder issues is that you don't ever really give any of this a lot of thought until there's a
indeed.
problem.
And what is the connection between the bladder health and our overall longevity?
I think if you're trying to manage bladder issues, so say you have to go to the toilet quite frequently, and for people who have overactive bladder or extreme bladder frequency, this can be upwards of 20 times a day. You can imagine
Oh,
that's quite challenging to manage. If you have bladder leaking, which can be either as a result of extreme urgency, so feeling that busting feeling,
mhm.
having to rush to the toilet, not making it in time, or what we call stress incontinence, which is what happens if we do things like coughing, sneezing, jumping, heavy lifting. Those things create a pressure on the bladder, and if the pelvic floor isn't ready for that or isn't strong enough to
Hold it.
support, then we have
Yeah.
a pressure leak. So if you're an older person who's experiencing some of these bladder changes, these bladder problems, it can be quite stressful and anxiety provoking and um, inconvenient to manage these things. So, and the other issue is that as we get older, we are a bit less mobile. So it actually gets harder to get to the toilet.
Mm.
If we have arthritis in our hands, it gets harder to quickly undo our belt buckle and trousers. So
Oh,
sometimes these issues will actually start to impact on people's ability to participate in their day to day activities. So whether that's going shopping or going for a walk or saying yes to a social occasion where maybe they don't know where the toilet is, all of these things become much more difficult. And so people just stop doing them. And obviously, the less we do and the less we put ourselves out there, the more functional decline we'll often see. So if you're not going out for your walks anymore, you're going to lose fitness, you're going to lose pelvic floor tone. So it can be a bit of a vicious cycle. So, in terms of supporting longevity for people, we need to make sure that their bladder and bowel control is at a level where they're really comfortable, that they can still manage that and get around and do the things they want to do.
I see. So it affects social activity, which then in turn affects the cognitive function and our bodily functions.
Absolutely.
And how do diet and hydration impact our bladder health? And are there specific foods or drinks to avoid?
So the bladder lacks for mostly water to be coming in. So the things that sometimes will make a cranky bladder, one is dehydration. So if your
Mm.
urine is quite concentrated, that in itself can be quite irritating to the bladder lining and the urinary tract. So a
Mm.
lot of people who need to wee frequently think, if I drink less, then maybe I'll wee less. And they think that that's going to be a helpful strategy. But really strong concentrated urine in and of itself can exacerbate that urgency and frequency. So it's actually not a
Ah.
great strategy a lot of the time. So so yes, drinking enough water so that your wee is a pale yellow color, because we also don't want to overhydrate. There are people out there who are drinking 5, 6 liters of water a day thinking more is better.
Oh.
But particularly if you're managing a bladder problem, drinking too much is going to mean your bladder is working harder. So we want to find that balance of appropriate hydration where we're getting enough fluid for our bodily functions, our wee's a light yellow color, but also not hydrating to the point where we're producing excessive urine.
Mm.
The other thing that hydration is going to help is bowel function. So, again, if we're
Mm.
dehydrated, that's going to dry out our stools and make us constipated. And constipation leads to straining, which weakens the pelvic floor and those supportive structures for bladder control. But the other thing that that constipation does is because the bladder and bowel are right next to each other in the pelvis, it can create pushing pressure and irritation on the bladder, which means it can't fill up as much, or it might get a little bit agitated and drive that sense of urgency and frequency. So
Mm.
hydration is important for both of those things, and they can impact on each other. Now, the other common bladder irritants that we see most people drinking are things like caffeine, so tea, coffee, things like Coke, Pepsi, energy drinks. Caffeine is something that will have a dual effect of potentially irritating the bladder lining, causing more urgency and frequency. But the other thing it does is it's a diuretic. So it actually makes
Mm.
us produce more urine, which is going to mean that we have to hold and deal with more urine. So I'm not anti caffeine. If I didn't have my morning coffee, I wouldn't be a happy camper. So I'm not saying you can't have it, but if we can keep it to a minimum and make sure that we're hydrating well with water around the caffeine, because there are a lot of people who wake up and they'll go coffee, coffee, tea, and actually have no water to dilute that caffeine content.
Mm.
So having your caffeine sparingly and not having caffeine too close to bedtime. So,
Indeed.
for some people, the effect of caffeine can be longer than you think. So, I've had some
Yeah,
people
indeed.
sensitive up to 12 hours after they've had a tea or coffee that still feels like it's affecting their urinary tract or their bladder system. So, that's something that we might look at if someone is weeing a lot, particularly at night. And then anything with a lot of fizz, carbonation, sugar, particularly artificial sweeteners, all of
Mm.
those things are known bladder irritants. So, and there's just nothing beneficial in those things anyway. There are some health benefits to tea and coffee and green tea. So, I think it's okay to kind of try and make those work. But honestly, Coke, soft drink, they don't have a lot of redeeming qualities. And if you're suffering with bladder issues, I would just say, can you drink something else instead? So herbal tea can be a good alternative if you're just looking for something that's, not water, because herbal teas often won't have anything in them that are problematic for the bladder.
I see. What about stevia? Because you said something about sugar and artificial sweetener, and people tend to change that to stevia for their sugar cravings. Does that also affect bladder health?
I would say do a bit of trial and error yourself.
I
So
see.
if you're symptomatic, I would try, okay, how do I go with normal sugar versus an artificial sweetener versus no sugar at all? And
Mm.
does that have an appreciative difference on your symptoms? Because not all of this is going to be important for everyone. There'll
I
be people listening
see.
who go, geez, I have, 5 cups of coffee a day and,
Yeah.
2 stevias in everyone and my bladder's just fine. And that often can be the case. If you're well and healthy, your bladder's functioning well, there's no inflammation, everything's kind of ticking along, then, that it might not be a big deal, but it is something worth thinking about to test if you are suspicious that might be a problem for you.
I see. And usually for the bladder health, it's the hydration intake. Does food have a role in bladder health as well?
Some people might be sensitive to acidic foods. So,
Mm.
like your citrus, maybe tomatoes. Sometimes people might be a bit sensitive to spicy foods.
Mm.
I wouldn't routinely tell people to cut those things out necessarily. I would start with the liquids. So yeah,
Okay.
the are you drinking enough water? Are you having too much caffeine? What's the timing of your caffeine? Alcohol is another big one that can cause big bladder dramas because alcohol's quite a strong bladder irritant as well. And particularly
Mm.
if you're going out and you're having a few drinks in a row, then you've got that double effect of consuming a high quantity of fluids in a short period of time, maybe not as quickly as what you would drink your normal beverages. So we've got this, irritating effect, this sudden loading of irritants. Alcohol can be a bit of a diuretic as well, so a little bit of extra urine production. So alcohol's another big one where I would say, ugh, can we cut this down or try and find some kind of alternative?
And what role does exercise play in promoting bladder health? And are there any exercises to avoid if someone has bladder issues?
So, as a general rule, all exercise that you enjoy that feels good for your body is going to be overall good for you. So, we know that people who are less stressed and anxious tend to have less symptoms of things like overactive bladder and other sort of pelvic conditions. So, exercise is ticking the box of helping with our mental health and our coping and our stress. It's also helping with our general fitness, muscle strength, bone health, weight management.
Hmm.
So, again, coming back to if we're carrying particularly too much weight around the tummy, that's going to be difficult for like the bladder and the pelvic floor to manage. Um,
Right.
there will be some people who don't feel great doing high impact exercise or heavy lifting,
That's right.
particularly if you have bladder leakage that's due to that sort of sudden high pressure rise. So it's not to say necessarily that you can't do it, but I would be obviously trying to, rectify the pelvic floor dysfunction that's going on that's maybe contributing
Mm.
and just keeping your symptoms in a manageable range. Um, f- there are some people who will have connective tissue issues that cause the bladder or the urethra, which is the tube that empties the bladder,
Yeah.
to move a little bit too much. Prolapse, bladder prolapse, where the bladder in women sits a little bit lower, which can be a consequence of childbirth and menopause and different things.
Hmm.
They sometimes can get worse over time if we're doing a lot of repeated heavy loading where that connective tissue is constantly put on stretch. So that will sometimes cause a bit of a weakening of those tissues over time, which can lead to the issue getting worse. So
Mm.
all of this should be kind of put into, the individual specific context because say you want to go running because you love it and it's good for your mental health and that's where your friends are is at the running club and you get a little bit of leaking but it's short lived and you feel like you're getting stronger, it's helping you to keep the weight down, then that actually might be fine for you to do if we're kind of balancing the overall health benefit there. um,
Mm.
but if you're doing something where you feel like the bladder issues are getting worse and worse and worse the more you do it, then I would be looking to modify what you're doing. And it's not to say that you won't be able to do those things again. It might be worth looking at working with a professional like a pelvic floor physiotherapist to try and address the underlying cause there to get back to doing the things that you want to do.
And what steps can people take to prevent urinary tract infections, UTIs, or other common bladder related issues?
So UTIs are certainly more common in women, and
Hmm.
a lot of that is around the fact that our urethras are a lot shorter than in men.
Mm.
So obviously in men we've got the length of the penis where the urethra is going to be going um, a lot further. So it's harder for bacteria to migrate from the opening of the urethra all the way into the bladder in men. It's not to say
Oh.
it's not to say they can't get them, but it's just more common for women because they've got a shorter path to the bladder. The other issue
Oh.
for women is that the opening of the bladder or urethra is in quite close proximity to our anal sphincter. So
Yeah, that's
cross
right.
contamination can be a problem. So you'll often hear women advised to wipe front to
Front to
back when
back.
they're wiping after going to the toilet to make sure that we're not introducing bacteria from the back passage to that urethral area. So good hygiene, so keeping the area, clean, wiping front to back. The other thing that some women will be prone to is urinary tract infections after sexual intercourse.
Mm.
So again, it's a time where where bacteria might be introduced to the area. So doing a wee afterwards will often help just clear the urinary tract. So that can help reduce your risk there.
Mhm.
Constipation and IBS, managing those. So we already talked about constipation being a bit of a problem for the bladder because it will kind of compress on the bladder, and the straining can cause some issues with the connective tissues there. But IBS, particularly loose stool, so IBS with diarrhea dominance, there's that higher risk of cross contamination of that stool towards that urethral area. So sometimes when we're trying to manage bladder issues, we're actually fixing bowel issues to try and help the bladder stay a little bit happier. The other thing that women will be sensitive to is again that drop in estrogen, that change in hormones,
Mm.
particularly around that perimenopausal time. So the bladder sphincters and the urethra and the vulvovaginal tissues are all quite sensitive to estrogen. So when those levels start to drop, the tissues around that area can become a little bit thinner, so a little bit more sensitive, not as robust against infection and friction. So there are some women that do benefit from speaking to their doctor about reintroducing estrogen via an estrogen cream. So
Mm.
that will quite often help keep those tissues happier and healthier. It can improve pelvic floor sensation and blood flow, sexual sensation. So that, yeah, vaginal estrogen sometimes can be quite helpful for the women who are in that sort of perimenopausal, postmenopausal period to
Mm.
try and help reduce risk of UTIs or recurrence of UTIs.
We did talk a bit about IBS and how it affects the urinary tract, and a lot about UTIs and its effects. But how can individuals differentiate between normal aging related changes in bladder functions and signs of a serious condition?
Yeah, so I think the big key would be a sudden change. So
Mm.
there are lots of, particularly women who might have been putting up with quite low grade bladder symptoms, potentially since pregnancy and childbirth. And it might be at a level where they manage fine, it's not stressing them out, it's not a major inconvenience. If that if there's a sudden change to those sorts of symptoms, say as they're approaching perimenopause, then that's something worth getting reviewed. So it's not normal for the bladder to all of a sudden start becoming more urgent, more frequent, for you to suddenly start leaking. And particularly of concern would be if you start leaking without any feeling that you needed to go, or you weren't doing anything, strenuous. If it was just the bladder started leaking here and there for no reason, that's certainly a cause for concern and review with your medical practitioner. So it can be tricky because again, like it's sort of normalized that women around, those periods of pregnancy, postpartum and perimenopause should expect, a degree of these sorts of things to be normal, quote unquote. So I think the key thing would be to tell your doctor that it had been a sudden or rapid change for you, or that it was actually really quite concerning, because I think sometimes it can get downplayed a little bit because it is so common. A few of the things that
Mhm.
would, really warrant a trip to the GP: blood in your wee. So if you notice
Oh.
any bleeding at all when you're doing a wee, then that's something that you need to immediately flag for medical review because that's not normal. Um, Burning and stinging, are kind of the hallmark
Mm.
signs of a UTI. So don't always assume if you've felt that before that it is necessarily a UTI again. It might feel similar, but it might be different. Always good to check. And then for people to know that sometimes UTIs can be what we call silent. So children around pregnancy and then older adults will sometimes get urinary tract infections that aren't necessarily associated with that burning and stinging. So again,
Mhm.
if you're suddenly having a change in bladder symptoms or sudden bladder leaking, it sometimes can be like a silent UTI. So that's worth getting reviewed.
How does woman related issues like hormonal related issues such as PCOS affect bladder health, if any?
PCOS, um, I'm drawing a blank on how that might particularly impact the bladder, but certainly something like endometriosis can have
Mm.
a big impact on bladder and bowel function. So some of that is literally there are endometriosis lesions on the bladder or bowel, which is going to obviously create inflammation and pain and things. But the other thing that endometriosis or period pain in general can do
Mm.
is it can cause the muscles around our core, so our abdominal muscles, our back, hip muscles, and our pelvic floor muscles to start to get a bit overactive. So the muscles
Oh.
start holding too much tension, kind of in the same way, that stressed feeling that you might get where there's tension in your jaw or your neck or your
Mm.
shoulders.
Yeah.
So, if we're having stressful events happening regularly, we might develop this low grade neck tension. And that same thing can happen to women with their pelvic floor muscles. So,
Oh.
yeah, so the muscles can get tight and cranky, so the blood flow isn't good, which can make them sore. But the other thing it does is it's going to squeeze too much pressure potentially around the bladder and bowel like exits, which sometimes can cause pain and issues with emptying and all sorts of dramas.
I see. So somatic tensions where the body holds the stress.
Yeah.
And how often should individuals undergo screenings for bladder health, particularly as they age?
So there's no current recommendation for routine bladder screening per se, like there is for things like, breast
Blood.
checks and mammograms
Yeah.
or prostate checks or pap smears or cervical screening. So bladder, it would more be you identifying a change and you bringing that up with your GP, or if you had a family history of bladder cancer, then that would be an individual
Mm.
conversation with your medical practitioner about what sorts of screening or tests might be appropriate. But I think, as a general rule, an annual GP check is probably not a bad idea for all of us, just because we don't always know what's normal or what's
That's
okay.
right.
We might think something's perfectly normal because it's been going on for so long. But if you talk to your doctor or health professional, they might be like, oh, that's a bit alarming. Let's look into that. So we don't always know what's important information and what's not. So just that annual, well woman, well man check, I think is probably a good idea, particularly as we age, as there is, the possibility of lots of different health issues becoming more common as we get older.
I see. So, like a general entire body health screen.
Yeah, so just having a chat with the doctor and getting them to, ask you questions about, bladder, bowel, how's your stress been? Are you exercising enough? What's going on? Have you been feeling fatigued despite enough sleep? Like all sorts of things. We just want to make sure that there's nothing that we're missing or any opportunities where maybe there were some lifestyle things that could have been easily changed. Like tidying up your diet so that you don't have to go on cholesterol medication or, things like that. And then routine bloods, depending on your GP, they might go, oh, geez, it's been a while since we've checked that. Let's take a look, because that will sometimes show up things that we didn't necessarily know were there.
I see. We did mention a little bit about symptoms, and you mentioned something about sudden change. What are some other early warning signs of potential bladder problems that people should not ignore?
So the ones that we're considering red flags, which need pretty quick review, would be the things like blood in the urine.
Mm.
The bladder is emptying more often or more urgently than it normally did. The random leaking, the bladder not feeling like it's emptying properly
Mm.
might be another one where you still feel like you're going a normal amount of times, but when you go, you just have this sense of like, oh, it feels like there's still something there. Like that's a change as well. And then some general sort of red flags would be things like sudden unexplained weight loss. That's something that we
Ah.
really want the GP to be looking into, or unexplained fatigue, like feeling like you've just got no energy, tired all the time, but it doesn't make any sense because you feel like, you're eating well and you're sleeping enough. So those two things would be red flags to go and have a chat to the doctor to just make sure there's nothing nothing more serious going on.
Can you discuss the importance of early detection in preventing serious conditions like bladder cancer and its effects?
Yeah, look, all cancer, you're going to have more options and probably a better outcome the sooner that it's found. So
Mm.
the blood in your urine is really something that you shouldn't muck around with. That's something that's the kind of the biggest red flag for bladder cancer in particular. So
Ah.
we want to be getting that checked. And then in terms of like for example, prostate cancer. So that's something that we do have routine screening for. So prostate issues do go hand in hand with a lot of bladder issues because the
Oh.
prostate, the urethra goes through the prostate. So if the prostate is diseased or enlarged, then that is sometimes a contributing factor to bladder issues. And then we want to make sure that we're finding that quick enough that you've got good options and that you can, if you need it removed, you're going to get clear margins and you're not going to have the cancer spread. So anything that's a red flag for cancer, we want to really be getting that looked at as soon as possible so that you've got the best chance of getting onto a quick management plan and quick resolution of symptoms. So yeah, bladder and prostate cancer are two of those big ones.
And what advice would you give to someone hesitant, especially a lot of people feel ashamed about seeking medical health for bladder related symptoms?
Yeah, a lot of people do feel shame around bladder and bowel issues, even though it's super common. And the other thing is, I think we are often not talking about this a lot. So a lot of
Yeah.
people feel a bit embarrassed to bring it up. And we actually know that there are a lot of people suffering in silence who never tell their doctor because they were never asked the right questions. So as health professionals, we need to be really cognizant of that people are a bit embarrassed and that we need to give them the opportunity to bring up these issues. We need to prompt them because they're not always going to be forthcoming because there is a bit of shame and stigma around incontinence, so bladder and bowel issues, even though it is common. So 1 in 3 women will have some bladder control issues.
No.
50% of women will have a degree of prolapse. I think it's 1 in 10 men will have bowel issues. So it's, if you're in a room of 20 friends, you're not the only one if you've got these things going on. But because we don't talk about it, we think we're the only one. So it
Mm.
can take people a really long time to ask for help for some of these things. But I think just, yeah, get the courage up, go in, take a friend if you need support. But at the end of the day, it's all just health. All health professionals should be well versed in talking about all things bladder health because it's just another area of our health and well-being. So, I mean, from me personally, this is literally what I talk about all day long: bladders and bowels and pelvic floors. And it's normal for me. This is, it's very comfortable. Someone coming to talk to me, often you'll get the impression they think they're the only one that this is happening to. You're like, geez, you're the
Yeah.
fifth one I've had today. So for people to know they're not the only one out there, and finding a health professional that has a special interest area in the condition that they're looking for help with, then they know that they're in the right place, because if that's your special interest area, then you're very ready to talk about these things.
Does it affect, does bladder health or issues affect more to heavily on women or men, or is it just equally spread around?
Pelvic floor issues and bladder issues certainly would be more common in women for a host of reasons. So, the pelvic floor in women is having to work a bit harder because women's pelvises are they're wider. For us to have babies, we need wider
Mm.
hips. So the pelvic floor, which is that group of muscles that makes the floor of the pelvis, running from our pubic bone at the front to the tailbone at the back and between the two sitting bones, it just has to work harder over a higher area. So that's the first thing working against us. Then we have the hormonal things that happen with
Yeah.
our menstrual cycles and pregnancy and postpartum. All of those things change the the way that our pelvic floor and connective tissue can function. So that predisposes us to issues. Then childbirth itself, so vaginal delivery, obviously those pelvic floor muscles have to stretch a lot to get a baby out. So that will often compromise the pelvic floor's ability to, bounce back and recover normally. But even if you have a Caesar, pregnancy itself is a risk factor for pelvic floor and bladder issues, because we
Mm.
have really sudden pressure and weight gain on the bladder and pelvic floor. We have changes in connective tissue from the changes happening from hormones. So having a Caesar is not necessarily a get out of jail free card. You know what I mean?
Yeah.
If you've been pregnant, then that is something that's going to increase your risk of pelvic floor traumas. And then again, we talked about how perimenopause is at a time where the decline in hormones can really affect the pelvic floor muscles, that bladder, urinary tract area, which can result in more symptoms for the bladder. So, generally, men can be also affected by things like overactive bladder and pelvic pain and IBS, of course, and they have a pelvic floor. But the the large majority of the pelvic floor clients that I see who are male are in that sort of 50 to 70s,
Later on in life.
related later and on in life, related to prostate issues. So
Mm.
we really love catching those guys before they have their prostate treatment, so they can learn the exercises first, because they've never heard of them, or they've never thought about them before. And it's really tricky to learn those exercises for the first time if you've just had an operation, because the
That's
area is going to
true.
be, tender and swollen, and the anatomies change. So we do want to catch them ahead of time.
Where can people find reliable resources or support for managing bladder health issues?
So your GP would be the first point of call. So getting their input, and they will often refer you if they think that there's another professional that might help them better. Pelvic floor physiotherapists, continence physiotherapists, and continence nurses. So we will give you heaps and heaps and heaps of things to work on to try and help with the bladder function and general overall health. And then if you're looking for online resources, I would probably head to the Continence Foundation of Australia's webpage, and they also have
Mm.
a great service, a phone service, so you can call their helpline. I actually think it might be 24/7, but it's like very frequently manned. So if you want to talk to someone anonymously, or if you're not sure if you need to go see someone, they would give you a bit of information to point you in the right direction. Or for women, Jean Hales for Women's Health. That website's very reputable. Lots of good information around pelvic floor, bladder, pregnancy, postpartum, and perimenopause and beyond.
Mm.
So they would probably be the main places. as a pelvic floor physio, obviously I'm biased and I think we're all awesome. And everyone who has any bladder problems should always touch base with physio. Even if your GP is sending you off for scans or your specialist input, rather than just kind of waiting for those things to happen, there's often a lot of lifestyle things that we can get started on ASAP while we wait for those tests and appointments and things to get going. So I would say the best time to start is now. Like get in and start taking action if you're having concerns, because the quicker you can start your treatment and your management plan, the quicker you are likely to see results.
And what steps should we take today to understand better about our bladder health? Do we just go for an appointment or what should we do?
So if you have symptoms, if you have bladder leaking, if you have bladder emptying issues, if you have bladder frequency or urgency or are waking up in the night an extremely annoying amount and it's impacting on your sleep and your quality of life and function, if you have any bladder issues that are stopping you from doing things like exercise and travel and socialize activities, if you have bladder prolapse, if you have any prostate issues, all of those things, I would say, go and see your local pelvic floor physio or continence nurse to get started on what might be the most important thing for you. And pelvic floor exercises are often going to be part of that treatment plan for a lot of people. So they are very effective if they're done properly and
All right.
prescribed properly for you as an individual.
And let's now go into the practices and habits that we can do. What daily lifestyle habits can help maintain a healthy bladder? You did mention a little bit about pelvic floor exercises.
Yep. So pelvic floor exercise is going to be helpful. Um, the hydration factor. So drinking not too much water, but enough water. Minimizing your bladder irritants like your caffeine, fizzy drinks, alcohol, exercise. So the current recommendations for general exercise in Australia are to try and be active most days of the week. So doing something for half an hour, like walking or swimming or bike riding, and then twice a week actually doing something with some resistance training. So for helping the pelvic floor, we do really want to make sure that our legs and particularly our glutes are strong. So doing something like weights, resistance training with bands, Pilates, body weight exercises where we're doing some muscle building can
Hmm.
be really important for helping to support that pelvic floor and therefore kind of bladder control. Healthy diet, so enough fiber, which is going to help with your bowels, enough protein, which is going to help with your energy levels and your ability to build and maintain good lean muscle mass, which is really important for our muscle and our bone health, particularly as we age and particularly around menopause. Um, Other habits, we a lot of people will do things like avoid public toilets or hover over public toilets
I
for
see.
fear of catching things. So I would not recommend that. It's really hard for your bladder to empty properly if you are
Mm.
not relaxed. So for the germaphobes out there, take a wet wipe or put some toilet paper down to be able to sit and relax so your bladder can empty properly.
Properly.
Yeah, because if your bladder's not emptying properly, one, you're going to have to go back to the toilet sooner because it's still got something in it, so it's not going to be able to fill as much. But the other issue is that it might put you at risk of urinary tract infections. So when we want it to be all gone every time. So there's not a lot of time for bacteria to kind of grow and multiply there. If you're always weeing and not quite emptying fully, then it gives bacteria a bit more of an opportunity to colonize. So for the ladies, really try hard to Find a toilet that you're comfortable sitting and relaxing on. The other issue is rushing. We see this a lot with
Mm.
busy busy people, and sometimes more likely to affect mums who are, trying to manage maybe, one or two small children, and they just don't have the time to sit and relax properly to wee. So if you're there to do a wee, really try and make sure you've fully emptied before you get up again, because it's not going to save you any time in the long run, because you're going to have to circle back quite soon anyway if there's still something there. So, taking the time, empty properly. Um, and what other things? They're probably the main tips.
Hmm. And from all of those main tips, I think I'll take one to focus on, which is the pelvic floor exercises.
Yep.
What are the three good things about pelvic floor exercises?
So, number one, it's going to help improve bladder and bowel control. So, it'll often
Mm.
reduce bladder frequency, bladder urgency, or that pressure leaking that people can get from coughing, sneezing, jumping, running. Some people will find they wake up less in the night because their bladder is behaving a bit better through the daytime. So, that allows their bladder to behave better in the nighttime because they've done that pelvic floor training and work. Um, so, yep, better bladder and bowel control. Um, Reduced risk of side effects in particular populations. So, if you're pregnant, then we've got great evidence to support pelvic floor exercises in pregnancy, reducing your risk of bladder leaking in pregnancy and beyond, and actually having positive impacts on labor. So, women who do their pelvic floor training sometimes will have an easier time with labor and a shorter pushing phase with labor. So, if that's not motivation, I don't know what is. And then pre and post pelvic surgeries. So, gynecological surgeries, prostate surgeries. If you've been doing your training ahead of time, you're less likely to have as severe bladder symptoms afterwards.
Mm.
And the other benefit of pelvic floor training is better sex. So the pelvic floor is really important for sexual function, sexual sensation, orgasm for both men and women. So we know that women sometimes will find that sensation changes, particularly around pregnancy and childbirth, around perimenopause. And doing the training helps to tone those muscles up, improve the circulation, and improve that sensitivity. So, yeah, so there's something for everyone there. So, pelvic floor exercises are very useful for a whole host of reasons, particularly if you are one of those populations that we've just mentioned. I would really recommend them.
Are there any challenges in doing the pelvic floor practices?
Yes, it is a very tricky thing to get right. So, I think the evidence shows that about 50% of people who think they're doing pelvic floor exercises, or Kegels as they're sometimes called, 50% of us are getting it wrong. So it's important, if you're not sure if you're getting it right or if you have symptoms, to actually see someone who can check your technique. The muscles are really hard to find because we can't see them. They're inside the pelvis. They're not visible like our other muscles. So it's quite difficult for our brain to figure them out. And the pelvic floor is actually made up of a whole group of muscles. It's not just one muscle. So being able to pinpoint that good squeeze and lift under the bladder versus that squeeze of the anal sphincter muscle, you sometimes will have a little bit of a hard time differentiating them or getting them all to work together as a team. So that's where I think a good pelvic floor physio is going to give you some good feedback and advice on those. The other thing is that if no one's really told you how to do them, then you might not be doing them enough to have an effect. So we need to make sure the dosage is right for you and your needs. So some people, they'll try and do, say, a 10-second squeeze, but when we go to assess them, they might only have endurance for 3 seconds. So to go for 10 seconds actually doesn't make any sense. They're probably at that point just using the wrong muscles to achieve that feeling of a squeeze, like their inner thigh muscles, their glute muscles, or their their abdominal muscles. So it's beneficial, but we know that it's beneficial usually in the context of it being prescribed by someone who's checked your technique and has kind of really individualized it to you and your situation.
For the general population, how often should we do Kegel or these pelvic floor practices, exercises?
Look, if you don't have any symptoms, then it's probably not super important to be doing these all day, every day. It's something that we might just want to think about here and there to make sure that we're keeping our pelvic floor toned and we're really keeping that ability, that sensation correct. As we get older, I would say probably not a bad idea to do it a little bit more regularly. And then if you're in one of those risky populations for pelvic floor problems like pregnancy, postpartum, perimenopause, pre prostate surgery, then I would say we probably need to be looking at doing it a little bit more often. So, as a general rule, 2 or 3 times a day if you're looking to affect change for a specific purpose or for specific symptoms. Sometimes more is better, but with how busy everyone is, I'm usually just hoping for shooting for 3 times, getting 2 times.
A
So it'll
week.
depend a day
Oh,
if
a
you're symptomatic.
day.
But yeah, if you've got no problems, then probably 2 or 3 times a week would be fine. Or just integrating it into your current exercise routine. So, a lot of people are doing things like yoga, Pilates, gym. So, you can just do your pelvic floor exercises when you're doing your other exercises, as long as you feel like you're doing it properly. So, if you're not sure of the skill, it's going to be a big ask to try and do them at the same time as you're doing, say, deadlifts or squats. So, but if you're good at it, if you're competent, then you might just be thinking about it when you're doing your other exercises, when you're going for your walk, that kind of thing, so that it kind of fits easy into your routine.
I see. Thank you very much for our deep dive on the bladder health, right? About especially about the pelvic floor exercises. So that was bladder health for life, and now we can go into the open mic segment where you can talk about anything that you're passionate about. Doesn't have to be related to the topic or discussion, but it can also be related to the discussion. You did mention a little bit about wanting to talk more about pelvic floor physiotherapy. Can you tell us more about what it means to be a pelvic floor physiotherapist?
Yeah, so I guess we've been talking a lot about bladder issues. So
Mm,
that's potentially the biggest population of patients that we would see, people struggling with bladder issues. However, we do see people who struggle with, continence, bladder, bowel, wind. So any issues with control there. The other thing that we will see is pelvic pain. So, we talked
mm,
a little bit about endometriosis and
mm,
overactive pelvic floor. So, chronic pelvic pain can be a really debilitating
mm.
condition. And often it's something where you've had all the tests under the sun and nothing's showing up. Because if it's muscular, if it's an overactive pelvic floor, that's causing the pain or contributing to referral of pain in the tummy, the back, the hips, or the pelvis, then it can be really hard to find the right help. I think doctors are really good at finding stuff that's really dangerous and getting on top of that quickly. But for things like incontinence and pelvic pain, sometimes it's taking a bit too long to get to the right place. And you might be familiar with the stats of, endometriosis, average 7 years till diagnosis. So
Mm,
some of these conditions, because there's nothing that's always showing up on scans or nothing obvious, and
yeah.
it's not urgent, then it's sometimes taking a little bit of time to get to where they need to go to get the right help. And pelvic floor physios are sometimes, I think, the best kept secret for managing stuff like bladder issues, pelvic pain, IBS, overactive bladder, those sorts of conditions. So, and prolapse. So we talked briefly about prolapse as well. So a lot of people think that once you get a prolapse that, you're just off for surgery. You need surgical correction. So when we're talking about pelvic organ prolapse, we're talking about the descent of any of those internal organs, being the bladder, the uterus, or the bowel, just descending and sitting a little bit too low in the pelvis. And again, 50% of women will have a degree of this happening. More likely if you've had, multiple pregnancies, vaginal births, big babies, that sort of thing. But even women
Oh,
who haven't had kids can have a degree of prolapse. So again, it's one of those things that's not always inherently sort of dangerous or urgent, but the feeling sometimes can be that your bladder or bowel isn't emptying properly, or there's control issues, that there's a real sort of heavy dragging feeling in the pelvis, or like there's kind of a bulge or a lump around the vaginal opening. And
mm,
that can be really distressing for women. And often they're just told, don't lift heavy things and don't run and don't do this and don't do that,
that's right.
as a way to manage. But we
Hmm.
talked about all of the benefits of exercise.
Weightlifting,
So
yeah.
yeah, so weightlifting, particularly in menopausal women, can be really valuable for improving their bone health, their muscle mass, their general strength and function. So if you're telling women, particularly older women, don't do these things, well then they're going to decondition, which is actually going to potentially make it worse. And then they're frail and they can't cope with day-to-day things. So
Mm,
pelvic floor physios can be really valuable in trying to help improve that pelvic floor to try and support those organs better and give them other options that are non-surgical, because sometimes people don't want to have surgery if they don't have to, or it might be that they're on a long waiting list, or they're not in a financial or social situation to have surgery. So if you say are a grandmother and you have grandchildren sort of support duties, well, you can't lift them. And
mm,
sometimes surgeons will say, you can't lift anything heavier than 10 kilos ever again after this surgery. Well,
mm.
then you can't do the things that you want to do. So a lot of women are trying to find other ways around it. So pelvic floor physios and gynecologists will sometimes prescribe something that's called a vaginal support pessary. So it's an internal splinting device that goes inside the vagina and actually helps to scaffold and support the organs. So this is a non-surgical, quick, safe thing for women to try that's going to help them to feel more confident and less symptomatic, but two, be able to get on with things, get on with life, be able to garden and exercise and stay strong and well and social. So that's again, sometimes it feels like a little bit of a well kept secret that there are other things that women can do other than just corrective pelvic surgery.
Wow, what an insightful talk today. And wrapping up our episode, if our listeners want to find out more about you and what you do, Misha, where can they go?
So you can find me and my website at pelvicfixphysio.com, or you can catch us on social, so Facebook and Instagram at Pelvic Fix Physio. If people want to contact me directly, I'm very happy for email. I'm a bit old school. I'm not awesome at socials and LinkedIn and things. So my email is Mischa, Mischa, at pelvicfixphysio.com.
Thank you, Misha, for joining us today. It was certainly an insightful talk, especially about bladder health for alive and pelvic floor. And I hope our audience has learned a lot from you as well. To our audience, thank you for listening and tuning in today. And we'll catch you in the next episode. See you next time.
You have been listening to Aging Less, the Longevity Science Insights podcast produced by LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, YouTube, and other podcasting apps available on your devices. If you enjoyed this episode, please rate, share, and subscribe to our channel so that other people can find it and we can continue to provide quality content. More of our work can be found on our website at longevity.lifemanagementsciencelabs.com, where you can join our movement. I'm Marie Stella. Thanks for tuning in.